It is widely known that diabetes is the most common endocrine disease in the world. In the US alone, 23.1 million, or 12.2% of adults age 18 or older have been diagnosed with diabetes.
It means there is one diabetes patient out of 10 people around us, so it is really a serious problem now.
With the rising cost of insulin, many patients cannot afford their medicine. The healthcare industry is under pressure to lower patient costs while maintaining quality. Only since 2015 have there been biosimilar insulins on the market. Additional biosimilars would result in lower insulin costs and more accessibility for patients, not just in the US, but globally.
In China, there is a dramatic increase in the prevalence of type 2 diabetes in recent years. In the 1980s, the prevalence of type 2 diabetes is less than 1%. The latest data showed the prevalence reached 11%.
China is now an aging country, and we know the prevalence of diabetes is much more higher in the geriatric groups. And for the Chinese genetics, we are predisposed to type 2 diabetes also. So together, it makes the pandemic.
In China, then the physician attend a patient per visit. Average time is 6 minutes. So it focuses on the treatment, not focusing on the self-care abilities.
In patients treated with insulin, the percent of the patients who could achieve the target HbA1c less than 7% is less than 30%. The reason for that, I think, is not only delayed start of insulin use, but also not so positive adjustment of the insulin dose.
According to the recent survey, we have 200 million pre-diabetes. So it's not easy for the clinicians to intervene to prevent them from developing diabetes. We are working with the government, try to encourage the healthy lifestyles.
With the optimization of policy in China and better understanding of diabetes, insulin treatment, more and more people will have a good glycemic control and will have a better outcome.
For the type 2 diabetes management, we follow the comprehensive management theory and recommended by the Chinese Diabetes Society's consensus. We recommend the lifestyle management for all the diabetic patients.
Since the doctor only have 6 minutes, so the rest of the tasks should be completed by another multiple disciplinary team. So we think this is maybe the key point to solve this problem.
As a doctor, I really hope that the prevalence of diabetes could be lower in the future. We have to work together, our doctors and the patients and also nurses, to lower the prevalence of diabetes.
我们将恪守振兴中国医药产业的，让甘李成为糖尿病行业的全球性大公司，为世界范围的糖尿病人提供优质的产品和服务。